Few more people have joined now, so I am going to get started. Hi, everyone. Thank you so much for joining us tonight. We always appreciate people taking the time out of their evenings to support the fertility conversation. Our goal always at TRIO and at Conceive Health is to help navigate individuals through their fertility journey by hosting educational sessions like these and opening conversations regarding the topic. Tonight we have Dr. Akanksha Kulshreshtha from TRIO Fertility and Dr. Rachel Corradetti-Sargeant from Conceive Health to discuss how to optimize your fertility naturally, understand your menstrual cycle and timing, identify lifestyle factors that can improve your chances of conception, and recognize when it may be time to seek expert support. We're going to have both of the ladies present, and then we will have some time at the end to go through a Q&A with everyone. So please feel free to input your questions in the Q&A box that you should see on your screens throughout the presentations, and I will read aloud each one at the end for each of the doctors to answer. And there is an option in that area for all of your questions to be anonymous as well. So to begin, Dr. Kulshreshtha is one of our reproductive endocrinologists at TRIO. She has a strong interest in research and innovation in reproductive medicine, with a focus on recurrent or early pregnancy loss, polyendocrine metabolic ovarian syndrome, also known as PMOS, and focuses a lot of her time in the community educating patients and healthcare practitioners on the world of fertility. So, Dr. K, feel free to take the floor.
Thank you, Alex. I'm just going to share my screen. I hope you're able to see that now.
Perfect.
Good evening, everyone. Once again, thank you, Alex. I'm Dr. Kulshreshtha. I'm one of the reproductive endocrinologists and infertility specialists at TRIO Fertility. And today we're really going to talk about something that sounds like it should be very straightforward, how to get pregnant. But in reality, there's a lot of information and misinformation out there. And so I hope with today's discussion, you'll get a bit of a guide to optimizing your fertility. And some of my objectives and my goal is really to take you back to the basics. I want you to understand how pregnancy naturally occurs, how to optimize your chance of conceiving, when to ask for help, and how lifestyle and complementary care fit into the fertility treatment. And so with that, let's talk about fertility a little bit. So when we think about when pregnancy happens, it actually requires many steps for a pregnancy to happen correctly. Fertility is a team effort between the egg, the sperm, the uterus, and all the hormones that sort of help all this happen. So each month, your brain actually sends signals through hormones to the ovaries, and that's how a follicle is developed, and that's how ovulation occurs. That's that one egg that's released each month with a menstrual cycle. The egg then enters the fallopian tube, and if there's sperm present there, then that's how fertilization occurs. And then that sperm and the fertilized egg travels to the uterus and then needs to implant into the wall of the uterus for a pregnancy to happen. So the menstrual cycle is sort of at the crux of all of this. This diagram is from so many textbooks and lectures that I've received since I was in medical school. And it really goes through all the things, the different things that are happening from a brain level, the ovary level, and in the uterus during a menstrual cycle. The typical menstrual cycle lasts anywhere between 28 days plus or minus 7 days. Ovulation is the LH surge. It's marked by the LH surge, which is actually 48 hours long, and ovulation happens 36 to 40 hours usually after the onset of a surge. And so one of the most helpful things you can do when you're trying to conceive is understanding your menstrual cycle. The first day of your bleeding is of full bleeding is called your day one. And during the first half of the cycle, that's called the follicular phase. I don't know if you can see my cursor here, but the follicular phase, that's when that one dominant follicle is selected and it continues to grow. And then that ends with the LH surge where you ovulate. And then the second half is called the luteal phase, where if you have sperm in the uterus, the sperm and the egg can meet. And you can see this growing uterus lining is ready for a pregnancy to implant. But if there's no sperm around, then that's when the hormones drop and then your next menstrual cycle happens. And so how do we actually test for ovulation? There's actually a few ways that women can do this. The simplest way is just to track your menstrual cycle. Generally, ovulation occurs about 14 days before your next period, but it's not necessarily on day 14. So it really depends on what your cycle length is like, but apps can really be helpful to estimating when your fertile window is, but they don't confirm ovulation. So menstrual cycle tracking, I find the most helpful when your cycles are regular. Another option couples can use ovulation predictor kits or the LH kits. This detects the LH surge in the urine, a positive test where you'll generally see two strips or two little stripes on the LH strip. That suggests that ovulation will take place within the next 24 to 36 hours. This is the easiest way to help time intercourse at home. But the truth is that it doesn't work for everyone. And the one population that always comes to mind when they have struggles with tracking their ovulation is the PMOS, or the previously called PCOS population. One, because they might have irregular cycles, so it makes it very hard for them to be tracking their ovulation. But the PCOS/PMOS population also has a higher baseline LH level. And so sometimes the ovulation predictor kits actually don't even work for them because their hormones are already at a high level at a steady state. Your body can also give you some clues about ovulation. So there are women who will track their cervical mucus, and around ovulation, the discharge actually becomes clear, slippery, stretchy. It's called this egg white-like mucus. And this is a sign of the rising estrogen level and your fertile window. Basal body temperature is another one. The trouble is that the temperature actually rises slightly after ovulation because of the progesterone. And this can confirm that ovulation has happened, but it's less helpful, like I said, to decide when to have intercourse that cycle. An fertility clinic, we have more precise ways, of course, of assessing ovulation, like using blood work and ultrasound monitoring. But for most people who are just trying at home, you don't really need to make this very complicated. Knowing your cycle, using the LH kits if you want a little bit more information is usually enough. This is one of the most important conversations I have with patients every day about age. The truth is that women were born with the eggs that they will have throughout their reproductive lives. This was decided when we were in our mom's wombs. And so with time, what happens is that not only the number of eggs start to decline, but the quality of eggs declined. And you've probably read this or seen it all over social media, but this really does change after the age of 35 to 37. There is a gradual decline, and we do find that the pregnancy rates start to decrease after this age. Miscarriage risk starts to increase, and there's a lot more genetic issues with the baby. And so this is why I encourage people to think about their reproductive goals earlier. Even if you aren't ready to have children right now, having information gives you options about your reproductive goals. So now let's talk a little bit about timing intercourse. This is one of the important concepts when you're trying to get pregnant, the fertile window. So the fertile window is a time during the menstrual cycle when pregnancy is possible. It's approximately 5 days before ovulation, with the day ending on the day of the ovulation itself. Sperm can survive for up to 72 hours in the reproductive tract, and it's important to know that. But the egg only survives for about 12 to 24 hours after ovulation. So generally, your highest chance of pregnancy is the 1 to 2 days before ovulation. And for the best chance of conception, aiming for intercourse every 1 to 2 days during your fertile window is really the best. So it's not really about finding the exact hour that you ovulate. Try to cover the fertile window when you are attempting to conceive. And so this is the question really that everyone wants answered, which is, when should we have sex to have a baby? And so my advice is generally quite simple. During your fertile window, aim to have intercourse at least every 1 to 2 days. And you don't need to have intercourse multiple times a day. You don't need to have intercourse every single day. If you're using an ovulation predictor kit, make sure you're having intercourse in the days leading up to that positive test, around the time it becomes positive and shortly afterwards. So for example, if someone has a 28-day cycle, day 1 is the first day of their full flow of menses. Likely you're ovulating around day 14. And so what I generally tell patients, even if they're sick and tired of doing the LH testing and monitoring, just have intercourse around day 10, 12, or 14, and that should catch the fertile window. And so you just want to make this easy and not sort of like a military operation, so that it doesn't sound like more of an assignment, and it's easier sort of to figure out when you want to do this. Now, some of the lifestyle factors are important to cover. Um, for females, we want regular physical activity. Adequate sleep is important. Balanced nutrition is important. Management of any underlying medical conditions. You, of course, want to avoid smoking, alcohol, cannabis, which have a negative impact on egg quality. And then in moderation, caffeine and stress. I think it's very important as you're trying to conceive to see your family physician to review any medical conditions you might have, to optimize any medications you're on, and stop harmful medications, because there are medications, for example, for acne, for hirsutism, that are not allowed to be taken while you're trying to conceive, and that could harm a pregnancy. And so it's important to just have that conversation with your family physician to optimize your medications. For men who are half of the equation, it's very important to avoid heat exposure to the groin area. Smoking, alcohol, marijuana, testosterone use, all of these have an adverse impact on semen health and sperm parameters. Obesity is another one. And so, when we're investigating infertility, a semen analysis is one of our first line tests. But it's important that we don't forget about the sperm component into trying to conceive. In terms of when to seek help, if you're under the age of 35 and you've been trying for 12 months, we generally recommend that's when you reach out and get referred to a fertility clinic. If you're above the age of 35, then after 6 months of regular unprotected intercourse, if you're still not successful, you should seek help. I think anyone that's 40 or older, you should come see a fertility physician much sooner. And then some of the other reasons why I'd recommend you be referred sooner is if you're a same-sex couple, if you have irregular menstrual cycles, you have no menstrual cycles at all, there's a history of pelvic infection or surgery, PCOS or PMOS, that it's now called, endometriosis, male factor infertility, recurrent pregnancy loss. These are patients who should come and see us sooner so that we can work them up and help them start their journey sooner. And what happens at a fertility assessment generally is that we take a history from the couple, about their medical history, about what they have been doing at home. And then we order a lot of testing, which includes some blood work for the couple, an ultrasound and a sonohystogram for the female partner, a semen analysis for the male partner. And treatment is truly individualized to each couple depending on what the investigations show. Next, we'll talk a little bit about nutrition and supplements. So some of the supplements that I always recommend my patients are on, one is a prenatal vitamin. The prenatal vitamin contains folic acid, and folic acid is very important to prevent neural tube defects in babies. Vitamin D, CoQ10, omega-3, these are all great in helping with egg quality, and there's evidence for all of these. Similarly, the vitamin D, I also recommend my male patients take it because, again, there is evidence that it helps with sperm health, and we also don't get enough sunlight here in Canada, and all of us run low in vitamin D anyways. But the truth is that there is no one-size-fits-all approach. And this is a great place for me to bring in Dr. Rachel, because nutrition, lifestyle, complementary medicine, they all play a role in supporting the journey of a couple trying to conceive. And so she'll talk about some of the approaches she uses. And so I'll just stop sharing here and have her take over. Oh, I think you're muted, Dr. Rachel.
Yes, thank you. I am muted. Okay, let me go ahead and figure out my side of this. I was not quite as smooth about this when I was testing it earlier. So, okay, let me know if you can see that. Yeah. And then, Alex, are you okay for me to just dive in?
Yeah, let me just do a quick introduction of you. Thank you,
Sure.
Dr. Kulshreshtha. So, next up, we're gonna have Dr. Rachel Corradetti-Sargeant. She is a naturopathic doctor with Conceive Health. As we mentioned, she treats her patients with personalized, functional, and integrative medicine. With special interest in fertility, she is very passionate about empowering her patients to make healthy changes that help them conceive. So again, please go ahead and you can start asking questions in the Q&A and we will chat about them after. But Rachel, you can get started.
Yeah, for sure. Thank you. Okay, so I'll probably just skip through some of this boring stuff because you already went through a large majority of it, which is great. And I'm just trying to bring up my presenter notes that I had before, and we tested this, right? And now it's not coming up for me, Alex, but that's okay. We'll figure it out. I'll move on to this slide here, and this is just a little bit of background for some people who perhaps aren't aware of, what a naturopathic doctor is. I still get that question quite a bit in practice. We just view the body in a little bit of a different way in terms of what we're trying to accomplish. So really trying to take advantage of what we can do with, nature, trying as well to teach patients a lot about their bodies and really taking a look at like a whole person approach. So things that I'll cover in my conversations with patients include, nutrition. Are there botanical medicines that are evidence-based and can be beneficial? Targeted supplementation. I love what Dr. Kulshreshtha said about it's not a one-size-fits-all situation by any means. Let's figure out what your body actually needs and can benefit from. We talk quite a bit about lifestyle counseling. And then, of course, in certain cases, we'll discuss adjunctive therapies like acupuncture and when that can be beneficial. So some of the things that I included in my slides, I'm going to kind of go through a little bit more quickly because Dr. Kulshreshtha really covered everything there. So I won't necessarily talk about these things here because all of that has been discussed. What I do want to focus some attention on now is really understanding this concept of improving egg quality and sperm quality and the timeline that it takes to accomplish that. Because oftentimes you'll hear this thing thrown around about, 90 days or approximately 3 months. And that essentially helps to really kind of overall explain that we can make a lot of positive change within that time frame. What happens with sperm improvements happen a little bit quicker with eggs. As Dr. Kulshreshtha mentioned, you're born with as many eggs as you will have. And so it's not necessarily that we can give you more, but can we improve the environment in which those eggs are going through some of their final maturation, which is when we're getting into that 3 to 4 month window prior to when they might be used. So there's a lot that we can do to help out. And so let's move on to discussing some of the things that we can do to help with, enhancing fertility outcomes. And so this is where we talk about approaching a balanced diet, managing sleep, managing stress, moving the body, reducing toxins, making sure that we're running the appropriate labs to understand what your body needs. And then, of course, as was already discussed earlier, really understanding what's going on with your cycles, figuring out when that ovulatory timing might be, and using that information to spot where there might be issues. Okay, so let's go through some of the particulars with respect to nutrition. When we're talking about nutritional fundamentals, one of the most evidence-supported approaches to nutrition for optimal fertility outcomes is a Mediterranean diet. And this is a really interesting approach to nutrition because there are some very unique tenets that are included in a Mediterranean approach, but a lot of it is the stuff that we really know and hear and simply often need help applying to our everyday lives, right? So certainly one thing that I discuss literally every single day, multiple times a day, is helping patients achieve adequate protein in their diets. It's quite interesting how protein deficient a lot of people tend to be. I will ask people, do you think you get enough protein in your diet? they'll say, well, I try. And when we start to go through the nitty-gritty details and we discuss numbers, like a minimum of a gram of protein per kilogram of body weight, it can become obvious that patients aren't getting enough. But when we're choosing the types of protein that can be beneficial, that's where, some of the information from the Mediterranean diet can be really helpful. So we'll talk about things like choosing fish, right? Certain fish sources to help with reducing inflammation, getting those good omega-3 fatty acids that were already mentioned as beneficial for egg and for sperm quality. We'll talk about choosing protein sources that are lean, not necessarily full of saturated fat. We talk about choosing protein sources that aren't fried, for example, choosing overall, can we aim for lean poultry? Can we aim for eggs? Can we aim for dairy products? Often here you'll hear something along the lines of lower fat dairy products. That's a bit of a tenet of the Mediterranean diet. So those are some things that you can pay attention to when it comes to making good nutritional choices to support your fertility. Interestingly enough, there's quite a bit of discussion about healthy fats within a Mediterranean diet too. So you'll see that one of the tenets is actually trying to aim for about 40 milliliters of olive oil a day, which is quite a bit. But when we look at, well, what's the benefit there? It's because we're getting these healthy, unsaturated fats, and we really do need adequate fat intake to support healthy hormone production. I think fat often gets a bit of a bad reputation, but we require it in order to create good, healthy hormones. So that's important. The other thing that becomes really important with the Mediterranean diet is adequate vegetable intake. And so you'll often see within the tenets of that approach that we're trying to accomplish, half your plate as vegetables at your major meals. I'll tell you something that I often see in practice is a situation where patients often have their starch intake and their vegetable intake kind of flipped. So you'll see, for example, that they might be sitting down to a dinner plate and half their plate is starch. It might be rice, it might be pasta, and there may be, a small portion of vegetables, maybe just a quarter of their plate or none at all. So we can often just very easily reverse that and try to accomplish half the plate as vegetables in the major meals, and that can be really beneficial. So those are some things to think about from a dietary perspective. And then, of course, there are key nutrients that we're really trying to accomplish. Choline is another one. Obviously, folic acid, we all know that's super important. That's been discussed for a long time. But choline is actually getting a lot of, I guess, press time these days because we're learning that that is equally important in some respects. And so choline can be accomplished through dietary sources. Some of the sources are interesting. For example, a good source of choline is chicken liver, which most of us don't eat these days very often. But eggs are actually one of the best sources. So if you are someone who enjoys eating eggs, it can be fairly easy to accomplish your choline needs from eating eggs. It is in the yolk, so you have to make sure that you do eat the full egg. Choline sources, ideally, we're aiming for about 400 milligrams preconception per day, 450 milligrams in pregnancy, and you actually need even more when you're producing breast milk. So really important nutrient to think about if you haven't thought about that before. With vitamin D and with iron, those can both be quite beneficial. It is really helpful to test and not guess with those agents. Most of us are absolutely vitamin D deficient in Canada because we don't get very much sun, as Dr. Kulshreshtha said. I really like testing that and finding out exactly what the level is so that I know exactly how to dose patients so that we can correct the deficiency. And we can correct it pretty easily. I love seeing, patients initially getting labs done, starting a vitamin D protocol, and within 3 months, the deficiency has corrected, and all we have to do at that point is maintain it. So it does generally correct pretty easily, and it's very beneficial for both the egg provider and the sperm provider. Iron, of course, can be beneficial, but it's not necessary or helpful for all people. In fact, some people hold on to too much iron. So again, it's one of those things that's really helpful to test and not guess on, because certainly that's something that we want to make sure that you don't have too much of, okay? So those are some thoughts around the dietary approach. Let's talk about some of the things that can reduce fertility. And so these are some things to think about. And Dr. Kulshreshtha really touched upon a number of these things, which is great. Certainly when, marijuana was legalized here in Ontario, I know a lot of people were very happy. And I was sitting in the back row going, oh no, this is going to cause problems. And so most days in practice, I am seeing patients coming in who are using marijuana on a regular basis. And so, I'm certainly discussing with those patients the importance of stopping that, understanding why they're using it to begin with, and figuring out ways that we can try to address their needs in other ways. Okay. Some people use marijuana for sleep, for pain management, sometimes for managing stress and anxiety. And so we can talk about other approaches to addressing those concerns that don't involve something that's going to harm your fertility outcomes. Okay. We already touched upon alcohol and caffeine. I think most people know that. To put some specifics around that, alcohol consumption, so the evidence suggests that we're really trying to limit you to 4 drinks or less per week. Certainly in certain fertility treatments, 0 is best. Caffeine consumption, this is really interesting these days because there are so many different ways to access caffeine. And the things that I see coming into my office most days are people who are getting enormous coffees from Tim Hortons or Starbucks, a lot of energy drink usage I see. And so it's helpful to really do the math and figure out how much caffeine are you actually consuming and what are we trying to aim for. And specifically in the partner who's providing eggs, I often encourage them to try to get their intake down under the 300 milligram mark per day to get optimal outcomes. In certain cases, for example, in recurrent pregnancy loss, there is evidence that much lower than that is actually preferred, but it's definitely something to think about, okay? This has already been mentioned, but really trying not to just go into the health food store and buy everything that's on the shelves. There's a lot of misinformation out there. There's a lot of stuff out there that you don't need. I'm a naturopathic doctor. I've been, in this field now practicing for over 12 years, and I go into a health food store and often get overwhelmed by everything that's in there. I don't know how the general public must feel when they're just, bombarded with all sorts of information on what's in stores. And then we see so much coming through on social media platforms these days, whether it's Instagram or TikTok. And so we have to be really careful because unfortunately, there are a lot of people out there who are being asked to, sell certain products because of their clout. And unfortunately, it's not necessarily appropriate for everyone. So it's really important to understand what are the things that are actually going to work for you. What does have evidence behind it? What are the doses that we're aiming for? What are the interactions it might have with medications you might be using? Especially if fertility medications are involved, we want to be extra careful. Okay, so that's important. Another thing to think about is environmental toxins. So PFAS, BPA, that should not say paragons, that should say parabens, excuse me, that's a typo, my apologies. Other endocrine disruptors like phthalates and parabens can come up in a lot of standard products that are out there on the shelves these days. So when I'm chatting with patients in an initial consultation, I'm generally trying to understand what is your plastic usage like in your day-to-day life? What types of products are you using for your personal care, for the cleaning of the home? Are you using a lot of scented products? Artificial fragrances, for example, can be problematic. So these are some important things to think about and really trying to approach personal care, cleaning products in a more natural way, limiting plastic usage, thinking about things like plastic water bottles, plastic food storage containers, Keurig pots, right? Keurig pots are plastic and then we're shooting hot water through them. That's not great when we talk about leaching BPA. So those are some things to think about that you can, really reduce your usage of in order to help optimize your outcomes. So that's something to consider as well. Just as we come to the end here, I wanted to share some resources with you. So these are a number of books that can be helpful with getting some more information on things that can really help with improving your fertility outcomes. Certainly, a book like It Starts with the Egg by Rebecca Fett is well known. It's been around for a long time. I've had lots of patients come in who have said they've read that book, and they also come in generally with every single supplement that's mentioned in that book too. Again, not everything is appropriate for everyone. So you have to take the information in these resources with a grain of salt, but it can help to, up your knowledge in this department. So that's a good list to consider. Another thing that's really helpful when you're going through this is really creating your community and finding supports that can help you through this time. We mentioned the importance of improving sleep, improving stress management, and certainly supports like meditations, counseling, community supports can be really beneficial. We see time in nature as another thing that can be really helpful when it comes to managing your circadian rhythms, helping you with accomplishing adequate sleep. I had a conversation with a patient today who was having difficulty with her sleep. And, question number one for me was, okay, well, where's your phone at bedtime? And of course, the answer is right in front of her face. So we had to talk about limiting the usage of screens prior to bed so that we can really improve melatonin production and allow people to get better quality sleep. I mentioned PARX for people who are working with me in practice. I can actually write prescriptions for Parks Canada passes so that you can go and get one and be able to access the parks here in Canada for free. So we really try to encourage time in nature, time in sunlight, especially at this time of year as something that can be beneficial. Okay. So Dr. Kulshreshtha really already mentioned all of this here, so I'm not going to go through those details. Thank you very much for your time. If you have questions, I think we're going to open up the floor now to address those. And if you have questions that you don't necessarily want to ask right at this time, I've put a QR code here. This is a link that'll take you directly to booking a complimentary consultation with me, where I'm always happy to answer more specific questions. I'm just going to stop my share here and I will let Alex take over.
Wonderful. Thank you so much. We
I would say,
have a
yeah.
good handful of questions here, which is great. So I am just going to jump right in. Dr. K, you might be the best one for this one. What is the cost of initial consults and testing?
Before we jump into that, Alex, I just wanted to conclude the presentation. So I'm going to share my screen. Again, I
So
have too many slides.
sorry.
That is
Yes.
okay. I wasn't sure if you could see it. Hold on one second. And then I will address that, which is a great question.
Perfect.
I just wanted to wrap it up, everyone, with just saying that first step really is to understand your menstrual cycle. You don't need to obsessively track over every sign your body gives you. The second is to know your fertile window and keep intercourse very simple. The days before ovulation are particularly important. Every 1 to 2 days during that fertile window is enough for most couples, and it's very important to know that. The next is just to optimize egg and sperm health. So remember, both partners are important in this journey, and both egg and sperm health are important. Build a healthy foundation is the next one, whether it includes nutrition, movement, exercise, 30 minutes, at least 3 to 4 times a week is very important. Sleep hygiene, the appropriate supplements that you're on. But don't fall into the trap that you can control every aspect of fertility through lifestyle as well. And the last is, of course, to know when to ask for help, because there's no benefit in delaying this. And so if you do think you've been trying for a while, you haven't achieved success, it's probably time to see your family doctor to see if you can get a consult to see a fertility specialist. Even if it just means coming to see us, getting to know your fertility. Maybe you're doing something wrong. Maybe we'd recommend something differently. Maybe you're not even getting regular cycles and that's why you're not having success. But it's just important to get assessed if you feel like it's been too long. A simple plan for the first 3 months, if you're trying to conceive. In the first month, I'd really recommend starting a prenatal, if nothing else. Understanding your cycle length, so start tracking your menstrual cycles on an app, and then just have regular intercourse. The next month, you can try to identify the fertile window. You can add the ovulation predictor kits and have intercourse every 1 to 2 days in that fertile window. And in the third month, continue without over tracking, of course, because I don't want this to become an over consuming process either. Optimize both of your health, know your timeline for seeking help, but just know you're not alone in this journey and that help is always available. I just wanted to leave you with this website. It's pregnancyinfo.ca, the Society of Obstetricians and Gynecologists of Canada. Have created this patient-specific website talking about preconception, conception, things you should do and not do during pregnancy. But I do find it's a great resource that I have always turned my patients to, whether during residency and fellowship and now in practice. So hopefully you find it useful as well. And it's a lot of just the evidence-based information that all our guidelines under the Society of Obstetricians and Gynecologists of Canada follow. So it is really up to date, and I hope you find it useful as well. And with that, I'll end this presentation and then, sorry, let me stop sharing. And then Alex, back to your first question about whether the first consult has any cost or the testing involved. So the first consult, all consults actually are covered by OHIP when you come in to see a fertility physician. I'd say majority of the testing is also covered by OHIP. There are specific tests like your AMH test or any advanced testing perhaps that we do on the sperm, like a DNA fragmentation. Those would have additional costs covered, but generally most of the blood work, ultrasounds, sonohystogram, a basic semen analysis, these are all covered by OHIP. So there is no cost.
Wonderful.
As you have OHIP coverage.
Yes. Okay, perfect. The next one, Dr. Rachel. How do I know if I am low in vitamin D, or is it something you recommend everyone takes all the time, regardless?
So coming back to what I mentioned about testing, not guessing, most prenatal vitamins will have a bit of vitamin D in them, right? So if we look at some of the standard prenatal vitamins, they'll have generally around 600 IU. Other maybe better quality prenatals might have 1,000. So a lot of the times people will be getting some, but I do find it's helpful to get a sense of exactly where your levels are just through simple blood test. Unfortunately, vitamin D testing is not covered by OHIP, so it costs about $40 to $45 depending on which lab you're getting the testing done. But once you've tested, then we know, and we generally don't have to look at it again. Unfortunately, I do see people who come in using vitamin D supplements who will have their blood work done and they are deficient, even with a little bit in their system from their prenatal. So there are a lot of cases where we need to bring in more for a period of time to correct the deficiency before bringing them back down to their maintenance dosing, which may just be what's in their prenatal. I have also seen the opposite of this, where especially during COVID, there was a lot of information on the internet about using lots of vitamin D. And so I have also seen people come in with extremely high levels because they've been using way too much. Vitamin D is a fat-soluble vitamin. So what that means is you're not going to excrete the extra through urine. So you can unfortunately become toxic in that if you are taking too much.
Okay, great. And there was kind of a follow-up with that from someone else. You touched on it a little bit there, but how many IUs do you recommend for vitamin D daily? I know that it's kind of case dependent, but maybe for someone who doesn't spend as much time outdoors, will they automatically need more than someone who does?
In a lot of cases, yes. Unfortunately, some of it comes down to genetics, so it's hard for me to say exactly. So typical maintenance doses are around 1 to 2,000 IU per day, but that's for someone who already has adequate stores. It's a little bit hard for me to answer that.
I just wanted to
Okay.
jump in. I actually just blanket usually give around 2,000 international units to all my patients because, for the most part, most people do generally tend to be lacking in their vitamin D. The other problem, like Dr. Rachel mentioned, is not everyone can afford to do the testing. And so, even though I do include it in our initial workup, some patients will decline doing the testing, which is why I think for me, it works better when I see my patients to just use the blanket approach and at least they're getting the bare minimum. Whether they're deficient or not, that's okay. But I'm sort of happy with 2,000 international units for both the partners daily.
Great. Thank you. The next question, kind of both of you could touch on this, but maybe Dr. K, you could start from more of the medical side. I got a pelvic infection and PID post-sonohistogram, which was treated by antibiotics. What do you recommend one does to minimize the effects on fertility and the ovaries/fallopian tubes?
That's a great question. I'm sorry you got an infection and PID post-sonohistogram. Unfortunately, pelvic infections can cause scarring and damage the tubes, and that's even sometimes despite antibiotics. So we'd have to somehow check and see if your fallopian tubes are still open. Sometimes they can be blocked, again, depending on the severity of the pelvic infection. Other times they're completely fine. But once you've had an infection, it's challenging until we test you to see sort of what the effect is the truth. The impact on the ovaries is a little less. Once again, it really depends on the extent of the PID, whether you had abscesses in your abdomen, things like that. So I think it's sort of case dependent in terms of how fast and how great the impact on your fertility could be. But I would definitely, if you aren't seeing a fertility doctor, it would be a great idea to see a gynecologist or see your family doctor and get referred to a fertility physician, because I do think women who have had pelvic infections, PIDs, they can encounter challenges when trying to conceive. And so this is a population I'd like to see sooner in front of me, so that we can start investigating and treating and figuring out how to get them to conceive successfully sooner.
Great, thank you. There's kind of two in one here for Dr. Rachel. A couple of people asked about how long to actually start to see effects in reproductive health when starting to do those dietary changes, starting prenatals, vitamins, all of that. One person said, I've heard it's 90 days. Is that usually a good guideline of when you actually start to see the positive effects of all of these things for reproductive
Yeah.
health?
Thankfully, yes, right? We can see, and I would say it really depends on the case, but I'll often, for example, see in the sperm providing partner that we can see some great changes within that 90-day time period, right? And so that's always encouraging. Sometimes it's a little harder to nail it down when we're looking at the changes for the egg providing partner. But certainly we can start to see improvements with a variety of factors within that time frame.
Great. You both talked about just those classic lifestyle factors. So things like marijuana intake for both egg and sperm. This specific question, Dr. K, you touched mainly on the male factor with marijuana. So what amount of marijuana use affects the sperm? And I guess if you could touch a little bit on what exactly is it? Is it the motility? Is it number of sperm? Stuff like that.
Yeah, this is a great question. I looked into this research last year because I did a big presentation for the Department of OBGYN at U of T, looking at the impacts of cannabis on female and male fertility. And so there are a lot of papers, and there is growing evidence that marijuana use, even any amount, can impact actually all the sperm parameters from the amount to the motility. The majority of the times in clinic, the impact I see is on the motility. And it can have a very big impact on the motility. And you need a lot of sperm, millions of sperm that swim really well to make intercourse successful at home. And so when the sperm isn't moving well, this is not something you can actually figure out at home. And so that's the trouble, where you could be having regular intercourse, but if your partner or the male partner is consuming cannabis in any form, their sperm motility might not be great. And so that might explain why you're not conceiving. And so generally, my recommendation to all couples that I see are to stop consuming marijuana in any form for the female and the male partner, because there is growing evidence of its impact on egg quality as well. And so I think, when couples are really dedicated and want to conceive, this is something that they're more than willing to stop in order to see the benefits. And the truth is that sperm, like Dr. Rachel said, sperm regenerates every 3 months. Unlike the eggs that were determined when we were born, men get a whole new cohort every 3 months. And so if they do stop the marijuana use in any form, in 3 months' time, we should see a whole new cohort of sperm without the impacts of the marijuana use that they've had previously, which is great.
Great, thank you. I know that's definitely a hot topic, and we're seeing so much more. I know that you touched on we're seeing a lot more of that male factor in fertility nowadays. So just being able to help start the conversation of what exactly it is that we're seeing from that. This one, again, I would love if both of you could answer. Maybe Dr. K start from more of the medical side, and then Dr. Rachel to jump in and maybe discuss a little bit about what someone could do with lifestyle factors or naturally implement in their lives. So as a person who has suffered recurrent pregnancy loss, what are some things I can do if I get another positive test to support this pregnancy the best I can?
This is really tough. First of all, I'm sorry that you've had recurrent pregnancy loss. It is so challenging. Any loss, whether one or multiple, is incredibly stressful experience. And so if you get another positive pregnancy test, the truth is that unless we investigate to figure out why you're having the recurrent pregnancy loss, it is very hard to provide you with supports. So with another positive pregnancy test, I think it would just be to live that healthy lifestyle, ensure you're taking all the supplements, making sure you have that positive mindset. But the truth is, unless we investigate whether it's a genetic factor, whether it's a hematological factor like a clotting disorder, whether it's infections that are causing the recurrent pregnancy loss, it's a bit hard to provide the support to a subsequent pregnancy, which is why generally in the recurrent loss population, we're happy to see you sooner, do that workup, figure out what it is, if anything, that might come up with the testing that we generally do for this population, and then treat according to that to make sure and try to prevent these losses from continuing to happen.
Yeah, I really echo what you've said there, Dr. Kulshreshtha. It's challenging when I have patients sitting in my office going through that situation as well, to say, okay, do this and all will be well, right? We just can't. I mean, I usually am saying I have a list the length of my arm of reasons why this could be happening. So we need to figure out exactly what the situation is so that we can effectively manage the case, and hopefully prevent that from happening again.
Great, thank you. Dr. Rachel, what prenatals do you recommend? Is there specific brands? I know that you touched a little bit about vitamin D and all of that, but what would be kind of an umbrella of things that would be a great starter pack for someone?
Sure. So I have to be a little bit careful since, some of the people on the webinar are not necessarily my patients, so I can't be super specific on brands necessarily, but I can tell you things that I look for. So oftentimes I'm ensuring that there is adequate folic acid, of course. That's always times, not oftentimes, always times, making sure there's adequate folic acid. A good complement of B vitamins. Absolutely. Some prenatal vitamins these days will actually have a little bit of choline in them now, which is nice because we are seeing the benefits of that. In certain cases, there will be prenatal vitamins that are actually a bit more preconception in mind, and they'll include a little bit of coenzyme Q10. So those can be nice to look for. I'm not too concerned about omega-3 fatty acids specifically within a prenatal vitamin. Some will have them, some won't. I often find the ones that have them, it generally isn't a lot. And so preconception, I'm usually looking for, bringing that in separately. And yeah, again, just touching upon the concept of vitamin D, they'll generally be a little bit in there, but sometimes I'm bringing in a little bit more to make sure that the patient is getting enough. So as long as your prenatal vitamin is hitting folic acid, good complement of B vitamins, usually there's a bit of iron there, a little bit of iodine as well is generally something that it has to be in there. You're gonna see positive benefits from that, and then we can sort of target other things based on your needs.
Great, thank you. Dr. K, this is TRIO specific. Do I have to wait the full 12 months if I'm under 35 to be referred to TRIO, even if I don't have any underlying issues?
You absolutely do not have to wait the full 12 months. In fact, I always recommend get referred sooner because even getting your foot in the door, it might take a month or two to get that referral through and get you booked in with one of our physicians. And so I think whenever you feel like you've been trying and you might be hitting a roadblock, I think it's a great idea to come. You'll never know that and not every couple will know ahead of time that they have underlying issues, and that's the truth. And most couples actually come with no underlying issues, and it's only when we do some investigations that we figure out maybe maybe the tubes are blocked, maybe there's an abnormality in the sperm parameters, or something else is going on. Your thyroid levels are really high, and you need to be on medications. And so I think these are things that only with investigation you can figure out. And so the sooner the better is always best, I think.
Great, thank you. I think that's one of our most popular question that always comes up during all of our webinars and educational sessions. So that's great. Another one for Dr. K. If you do one medicated cycle of IUI and have mature follicle and good sperm quality and fragmentation data and you don't conceive, do you try again, or is it best to go straight to, they said IUI, but they might mean IVF for that?
Yeah, so again, this is a great question. Generally, when a couple does IUIs, they usually do a few. My answer will change depending on what all the testing results for the couple are. So um, I put a little asterisk beside saying doing multiple cycles because it's a bit hard to say without having all the sort of testing results in front of me. And so I do think it really does vary from couple to couple. But generally, if the sperm parameters are okay, the tubes aren't blocked, you have a good ovarian reserve, you're relatively young, I think it's okay to spend some time doing IUI cycles, and perhaps you'll fall in the unexplained infertility category, in which case definitely doing a few IUI cycles is totally fine. But I always tell my patients these days that, it's important to also set deadlines and be accountable. And so, whether it's 3 cycles or 4 cycles, if it doesn't work out, then perhaps you think about doing IVF. But I think this question's a bit hard because my answer might be different if you're a 40-year-old versus in your early 30s. And so it would really vary depending on the patient parameters. It's the truth.
Thank you. Okay, as of right now, this is our final one. It's kind of a two-part. So the first one, maybe Dr. K, you can touch on, and then I'll read the second part for Dr. Rachel. What are the effects of adenomyosis on fertility? This individual has been diagnosed by a gynecologist.
So, adenomyosis is a condition that's come to light a lot more, probably in the last 5 years or so. Previously, it was only diagnosed at the time of a hysterectomy. So, when a woman would have her uterus removed, the pathologist would look under the microscope, and that's when they would see adenomyosis in the muscle layer of the uterus called the myometrium. Essentially, what happens in adenomyosis is that the lining of the uterus migrates into the muscle walls of the uterus. I call it endometriosis interna because endometriosis, the lining of the uterus, spreads to different parts of the abdomen, like the bowels, like the intestines, the liver, the peritoneum, and gets inflamed every month during the menstrual cycle and responds to all the hormones. But in adenomyosis, that lining of the uterus actually migrates within the walls of the uterus. And so, because our ultrasound technology in the last 5 years or so has really drastically improved, we're able to detect a lot more subtle signs of this on ultrasound, which is why a lot more women are getting diagnosed with adenomyosis. Now, in terms of its impact on fertility, we are learning a little bit about the fact that it impacts the lining and perhaps impacts in implantation of a pregnancy into the uterus. But a lot of the research, I'd say, is still not as robust, and we are getting a lot more information about the condition and its exact sort of mechanism of action in impacting fertility. So I don't fully know how it impacts fertility is the truth. I think we will learn a lot more about it probably in another 5 years. So when I do see it, generally I talk to my patients that perhaps it's explaining some of the pain that they experience during their periods. Women with adenomyosis can also have heavier periods each month. And so those are things that you can manage with your gynecologist in terms of getting symptom control if you are. And then there are a lot of women who just incidentally get diagnosed with adenomyosis on ultrasound, but actually have no symptoms, in which case I almost sometimes say just ignore it because we don't exactly know how it's impacting you. You're not having any symptoms associated with it. And so it's hard to treat something that you're not even, you just picked up incidentally on ultrasound. And so, anyways, those are my 2 cents about adenomyosis. I'll pass it on to Dr. Rachel.
Yeah. No,
Thank you.
that's great. Yeah. So I think from my perspective, when I'm seeing that information across my desk, I think, of course, about the inflammation component. And so I typically am chatting with patients about ways that we can try to manage inflammation, right? And improve essentially I guess the happiness within the uterus, if you'd like to say it like that. So there are things that we can do with dietary changes, with certain supplement approaches that can be beneficial. And so we'll look into that. I'll often consider infection component. There has been some evidence with that as well. And so we'll talk about, is this the time and place where we might consider bringing in a probiotic so that we're getting that healthy immune system function within the uterus as well. And so that's a component that I'll consider, much like with managing endometriosis. There's evidence that optimizing those vitamin D levels, I come back to that now again, can be beneficial. And so that's something that I'll generally want to accomplish for patients in that case too.
Great. That's wonderful. Okay, I think we officially answered them all, and it brought us right to 8 o'clock, which is so perfect. So I will leave it there. Thank you both so much for presenting, and thank you to everyone who attended. We really appreciate you taking some time out of your Thursday evening. And if you have any questions, I will put my email in the chat, and we can connect further if anyone wants to discuss anything further. So thank you very much, and we will see you all soon.
Good
Thank
night.
you,
Thank
Alex.
you.
Thanks, everyone.
Take care. Bye.